Welcome back to another 𝗄𝗶𝗵 discussion. I'm 𝗤𝗶𝗵𝘆 and today I'm here with 𝗂𝗶𝗵𝘆. So today we're going to look into a very interesting topic, okay?
Yes.
That is myopia. Normally we do not get to see a lot of eye-related things, but
yes.
it is also a very common question that might be asked for the exam too, okay? There is a chance for that too. So we are going to look into myopia today. So the context is where the patient has visited you and the patient has the difficulty to view faraway objects. So you are asking questions. It's a normal kind of like a normal cue card where you ask questions and based on the symptoms you're giving your suggestion and then you're giving the reassurance to the patient, okay? So I'll handle the part of the nurse and Grace will be handling the part of the patient, yeah?
Yes.
So do you have anything to say about it?
Nothing more. Let us see the role play.
Absolutely. So let's begin?
Yes.
All right.
Your time starts now.
Good morning.
Good morning.
My name is Richa. I'm one of the registered nurses working in this hospital. Please be seated.
Thank you.
How can I help you today?
See, for the past few weeks, I have difficulty with my eyesight.
Okay.
I'm not able to see the faraway objects.
Oh, all right, okay. I understand that you're having certain difficulties at the moment and you're really worried about it, but
Yes.
please be relaxed. You have reached the right place and
Okay.
we will do everything to make you feel better, okay?
Thank you.
So could you please help me with your name and age for my documentation?
Yes, I'm James and I'm 38 years old.
All right, James. So I understand that you're experiencing certain difficulties. You mentioned that to me and that is worrying you so much too.
Yes.
And I know it is difficult for you to answer a couple of questions too, but I need some information from you. So if you don't mind, can I ask you certain questions?
Sure, I can help you with that.
So when did it start?
It started 2 weeks ago.
2 weeks ago. And any sort of recent eye injuries? Did you injure your eyes?
No.
Nothing like that, okay. What about eye strain? Do you strain your eyes so much?
Yes, of course, because I'm a software engineer and it is in my job to strain my eyes the whole day.
Fair enough, understandable. So do you have any other symptoms like severe headache or anything like that?
Yes, sure. I always have severe headache, especially after spending 4 or 5 hours in front of the system. I always get this headache.
Okay, so you are telling me that you spend 4 to 5 hours straight in front of your system,
Yes.
all right? And at that time you experience this headache, right?
Yes.
Okay, and one question I need to ask you is that do you have any family history of the same?
Nothing.
Nothing that you're
No.
aware of, okay? And you told me that you're a software engineer.
Yes.
So do you spend a lot of time working like that? Because you told me that you spend 4 to 5 hours. So is that on a regular basis or do you spend more than that?
Oh, actually, my working hours is from 7 a.m. to night 8 p.m. So it is something around 12 to 13 hours a day.
Oh, right, okay. So you're having a very stressful job, I assume.
Yes.
All right. So thank you very much for answering all my questions because I needed to ask you these questions to get a clear understanding of your condition.
Okay.
So from what you told me, I understand that it started a few weeks ago and you didn't injure your eye recently, but you do have a lot of eye strain because you are a software engineer and you spend long working hours in front of your computer.
Yes.
But you are unaware of your family history and you have an associated symptom that is headache, right?
Yes.
Yes. So before we proceed further, I would like to examine you. Is that okay?
Yes, it is.
Thank you very much. So I have finished my examination. So based on my examination and a discussion, I suspect that you might have a condition called myopia. Have you ever heard about it?
No.
Don't worry, I'll explain that to you, okay? So myopia is something known as nearsightedness, okay? Don't worry about the long term, okay? I'll explain that to you.
Okay.
So it means that the close objects will be clear, whereas the far objects will be blurry. That is what you are experiencing right
Yes.
now. You have difficulty in viewing the faraway objects, right? Yes, so that is what it is. And in this case, the cornea of the eye, it will be bulged than usual as well.
Okay.
So this is the nature of this condition too.
Okay.
And there are various reasons why this might happen, okay? It might be either due to the structure of the eye or there's a rare possibility that it might be passed on from your family. That's the
Okay.
reason why I asked you about a family history, because
All right.
if it runs in the family, there is a rare possibility it might be passed on to you as well, okay? And other reason can be due to severe stress, like visual stress. And in your case, I think that is the higher chance, because you are a software engineer and you spend longer working hours and you have this eye strain too. So the possibility of why you're experiencing this might be because of the visual stress, okay? And in some people, it can be even due to certain health conditions such as diabetes. What about you? Do you have any ongoing condition
No,
like that?
I'm completely healthy otherwise.
So we can check it out, okay? So I hope you're clear with all this explanation.
Yes, but I'm really afraid to lose my eyesight. Is that a possibility?
Well, it's not unusual to feel this way. If I were you, I would also be having all these queries, but please be relaxed, okay?
Okay.
I'm not trying to worry you, but this is a serious condition that needs proper treatment, because if we don't treat it properly and if we neglect it, there is a possibility that this myopia complications can lead to blindness, okay? So if you're not taking proper care of it, it can cost your eyesight.
All right.
So don't worry, although there is no proper cure for it, we can control it by undergoing certain treatments for it, and we can delay the progress of this as well, okay? So don't worry about it. For further information about it, I would like you to meet the ophthalmologist so that he can provide you further advice about what are the things that you need to keep in mind, okay? So he can run a proper test on you, and he will give you a proper definitive diagnosis about what exactly is wrong with you, and then you can take it from there, okay? So shall I book an appointment with the ophthalmologist?
Sure, you can.
Definitely. So it's been done, and please wait here for another 15 to 20 minutes. In the meantime, if you have any queries, please feel free to contact us, okay?
Yes, sure.
Thank you so much for your time.
Thanks.
So we have come to the end of this role play, right?
Yes.
I really enjoyed doing this one because we have a lot of things to explain
And this
here.
was a variety topic.
Yes, exactly. Normally we do a lot of clinical conditions, and eye-related problems are different cue cards, and we normally don't get that type of cue cards too. So in this particular cue card, it is self-explanatory. You do not have to come up with your own explanations. You have everything given here. You just need the practice of creating this
that is what the
sentences.
pattern nowadays what they get. Everything will be given in the cue card.
The
They
bullet
only have
points.
to, yes, they only have to explain it in the proper way.
Absolutely. So you do not have to worry about it, about what is this point, because some students have this worry about, oh, I don't know that medical condition, then what will I do? They always have this concern, right? And normally students come and tell me, ma'am, what will I do if I don't know the condition? You do not need to know about that condition, because whatever you have to explain will be given in the bracket. So you need to have the practice of connecting those bullet points into a proper statement, and that is what we are going to do straight after this role play, because there's a feedback session, and in that feedback session we'll show you how you can create statements very easily. So make sure that you guys watch it, and I hope this cue card session was very helpful for you guys. Please let us know in the comment section, and we'll come back with another role play very soon. Until then, take care.
Bye.
Hello everyone, welcome to the feedback session. So we just watched a video where we were talking to a patient with myopia, suspected myopia, and in this particular cue card you might have seen just now that we were providing all the information about the possibility of this condition, as well as what are the important things the patient needs to know about this particular condition as well. So we saw how the nurse was trying to explain all the points about myopia, as well as tell her the suggestions and give her options about the treatments, and also refer to the doctor. So let's see how we can create statements, or how we can easily move from one task to another in detail through this particular video session. So as you guys can see, this is our cue card, and we have the setting as hospital, and this is our background information too. So you are talking to a patient presented with complaints of blurry vision of faraway objects. The patient is petrified whether he or she might go blind. Okay, so this is the background information that is being provided. So now let's see the task analysis. So the setting, as you guys already know, is a hospital. And the scenario is where the patient is visiting the hospital for the first time, because nowhere it is mentioned that the patient had any particular consultation or met us before. So it's an unknown case. So we have to gather information about the patient during the role play. So background information and task number 1 will help you to frame the opening statement of the conversation. So let's see how it is being done. So this is your task number 1. Begin with warm greetings and find out the reason for the visit. Okay, so we have 2 segments. We have to begin with warm greetings, and we have to find out what was the reason for the visit. So let's see how it is done. Good morning, my name is 𝗥𝗶𝗿𝘀. I'm a registered nurse working in this hospital. So that is begin with warm greetings. Okay, so we just started the conversation and we introduced ourselves, and we said that my name is this and I'm this particular person in this hospital. Okay, you have stated the role and that you are working in this hospital too. So that is the first portion. Then the second portion is where we are going to find out the reason for the visit. Okay, and that can be done like this. You seem to be a bit upset. Is everything all right? Okay, so that is one way of doing it. Or you can even just ask the patient, how can I help you? Or what brings you here today? Or may I know the reason for your visit? There are a lot of ways through which you can ask or check what is the reason or the purpose of the visit of the patient. So this is how you can do task number 1, which is pretty simple and very direct too. So let's move on to task number 2. This is task number 2. Consult the patient and collect relevant details: onset, recent eye injury, eye strain, headache, family history, job nature. Okay, so see, the first point I have done here is consult the patient, because in our task number 2, the first segment says consult the patient. You guys can see it here. So this is the statement that I have used to consult the patient. Please be relaxed. You have come to the right place. Let me see what I can do to help you. Okay, or you can simply say, let me see what I can do. And then we are going to collect the personal details of the patient, because we need that, right? So we are going to ask, before proceeding further, I would require some personal information from you. May I know your name and age, please? So the patient said, you can call me Miss Williams, and maybe the age is somewhere around 42 or something. Okay, so here we are going to signpost, because we need to ask these questions, right? Because our task is to collect relevant details, so obviously we have to signpost. So we are going to say, Miss Williams, I need to ask you some questions to get a clear picture about your condition. May I? Okay, so this is one basic way of signposting. There are a lot of other statements that you can use too. You can ask questions like, if you don't mind, can I ask you some questions? Or you can say, in order to help you in a better way, I need to know some information from you, so can I ask you some questions? So there are a lot of different ways through which you can signpost and take permission from the patient to ask questions. Okay, so this is the signposting statement that I have used here. Now let's see how to ask each questions one by one. Okay, so the first question we have to ask is about the onset. So the question I have used is, when did it start? Okay, second one, recent eye injury. Did you by any chance injure your eyes externally, like a sudden poke or hit? Third question, eye strain. Do you strain your eyes a lot? Fourth one, headache. Miss Williams, do you experience any other symptoms such as headache? Next one is about family history. So we are asking a question, what about your family? Anyone in your family has the same issue? Or you can even ask, do you have a family history of the same issues? Okay. Then the next one is job nature. So I'm asking a question, are you working? So the patient is telling me, yes, I'm working. And then I'm asking the patient, could you please describe your work nature? The patient will tell you something like, yes, I am a software engineer and I work 13 hours a day, or something like that. Okay, you will get the information from the patient. So these are the different questions, and these are how you can ask these questions too. When you ask questions during information gathering, keep in your mind that it has to be precise and the questions has to be properly asked too, because there are chances of making mistakes there, grammatically as well as sentence construction mistakes. So please make sure that you learn properly to ask questions. Okay, so these are the questions that you can ask in this particular cue card and this particular task. So what you have to do once you have collected all the information is to provide a short summary. The purpose of this summary is to check whether you have collected all the relevant information from the patient. At the same time, we need to also check whether the patient has told you everything and not missed out on anything. Okay, so you need to provide a summary, and most of the candidates miss out on providing this summary as well. So make sure that you do this. Okay, it is important. It comes under information gathering. So once you have gathered all the information, you need to make sure that you check it with the patient by providing a brief summary about what you have understood from it. So let's see how you can provide that summary here. From what you told me, I understood that you have been experiencing the said symptoms for about 4 days now. You didn't injure your eyes by any chance. You strain your eyes a lot as you are a software engineer and your work requires you to spend long hours in front of your laptop. You have severe headache at times and you are unaware of any family history of the same symptoms. Am I right? See, this is the summary that we are going to provide here, and the summary is created based on the responses given by the patient to your questions. So make sure that you actively listen to whatever responses that was said by the patient so that you will not miss out on it. So that is how you can provide this summary. So once you have provided the summary, the next thing is you're going to move on to task number 3. So this is your task number 3. Offer to examine, explain that you suspect the patient has myopia. So this is our task number 3. So the first portion is offer to examine. So this is the question you can use. May I examine you? Okay, so it's a very simple question. The second portion is explain that you suspect the patient has myopia. So this is how we are going to explain that. Thank you for your cooperation. Okay, so we are thanking the patient for his or her cooperation for the examination. Okay, so we are saying thank you for your cooperation. Based on my examination and from what you have told me, I suspect your symptoms is suggestive of a condition called myopia. Okay, so that is how you are going to say that you suspect the patient has myopia. This is our task. So we are going to elaborate that point this way. Thank you for your cooperation. Based on my examination and from what you have told me, I suspect your symptoms are suggestive of a condition called myopia. Simple as that. Okay. Now, always remember, once you have told the patient or once you have disclosed to the patient that the symptoms are suggestive of something like this or something like that, you have to check with the patient what the patient knows about that particular condition or whether the patient has any idea about it. It is important too. So you can ask a simple question like this: have you heard about myopia? Okay, or do you know anything about myopia? Okay, so it is important that you check that part. Okay, it is really important. So once you have asked that question, the patient will say myopia, no, I don't know anything about it, I have never heard about it. Okay, then you can move to the next task. Okay, you're leading yourself to move to the next task very easily too. So your task number 4. Slowly explain what myopia is: nearsightedness, close objects clear, far ones blurry, cornea bulged than usual. Explain that it can be either due to the structure of the eye or a rare possibility of inheriting from parents, or due to visual stress or certain health conditions such as diabetes. Check the understanding of the patient. It's a pretty lengthy task, and while you see this long task, you might be a little worried about, okay, will I be able to complete everything properly, or how will I be able to, how will I be doing it or completing each point one by one. So what you can do is you can break it down actually. So if we can see here, we can break this task into 3 segments. First segment can be slowly explain what myopia is. Okay, that is the first segment. Second segment can be explain that it can be either due to structure of the eye and things like that. That means we are explaining the causes of it. Okay, that can be the second segment. And the third segment can be check the understanding of the patient. Okay, so if you divide your task into different segments, whenever the task is pretty lengthy, you can maintain the conversation as well as explain each point in a very proper and clear manner. So the clarity part will be much better in that area. Okay, so keep that in mind to break down the task into different segments for your easiness to explain the point. So here I have divided it into 3 segments. The first segment is acknowledge the concern first, which means this segment is an extra point that I have added here to show that when you ask the patient, have you heard about myopia, the patient will be very concerned and the patient will say, no, I haven't heard anything about myopia, what is it? And the patient showed a concern. Okay, so we are going to acknowledge that concern first before we get into the explanation of myopia. So I have used a statement here. I understand that you know very little about myopia. Don't worry, I'm here to help you. I'll explain everything in detail. Okay, so you're going to provide information and educate the patient here. So you're telling the patient, don't worry, I'm here to help you. Okay, that is the acknowledgement statement I have used. Then I'm going to explain what is myopia. Myopia or nearsightedness is a common vision condition in which you can see near objects clearly, but objects farther away are blurry. The cornea appears to be bulged than usual in this case. There are various reasons behind it, such as the structure of the eye, or it can be even passed down through generations if any. Visual stress or certain health issues such as diabetes can also cause this condition. Okay, so this is the explanation of myopia. Now I'll show you how I created this explanation from the statement given in the task. So here it is mentioned: nearsightedness, close objects clear, far ones blurry, cornea bulged than usual. Got it? So if you look at the explanation, I have explained it in a way like this, okay? Myopia or nearsightedness, okay? And I told the patient is a common vision condition in which you can see close objects clearly, but far ones blurry, okay? But objects farther away are blurry. And one more point which is mentioned here is that cornea bulged than usual. So I'm saying like this, okay? The cornea appears to be bulged than usual in this case. That is how you can explain that point. It's very simple. I've just expanded the points given in the bracket in a sentence here. Okay, you guys can see how it has been done. Then I also explain the various reasons. Explain that it can be either due to the structure of the eye or a rare possibility of inheriting from parents or due to visual stress. So, it is understandable that we are explaining about the different options or different causes why it might be caused. So I said usage like this: there are various reasons behind it, such as structure of the eye, which is also given here in the task, structure of the eye, or it can be even passed down through generations, rare possibility of inheriting from parents, okay? Or it can be even passed down through generations if any, okay? That if any has to be added there. Then the next point they have mentioned in the task card is due to visual stress or certain health conditions such as diabetes. I mentioned visual stress or certain health issues such as diabetes can also cause this condition. Okay, this is the complete explanation of the point which is being explained in the task card here. Okay, so once you have explained it, the next point is check the understanding of the patient. So that is what you're going to do here. We are going to check with the understanding of the patient by asking a very simple and short question. I hope it's clear to you. So the patient will be saying, yeah, that is clear for me. So that is how you will finish your task number 4. Now let's move on to task number 5. Try to console the patient and tactfully explain that if left untreated, high myopia complications can lead to blindness. Try to explain it can't be cured but controlled. Treatments to slow down the progress. Okay, again here we can divide it into 3 segments actually, because the first one is try to console. Okay, so that can be one point, and then we are going to explain the importance of treatment. Okay, so that can be the second point, and then the third segment can be we are trying to explain to the patient that it can't be cured but treatments can definitely slow down the progress of the condition. Okay, so 3 segments again for task number 5. So let's see the first segment, console the patient. I totally get that you're really upset and concerned about the entire situation. Please be relaxed. You can use any empathy statements that you want to, okay? Now, the second segment. Tactfully explain that if left untreated, high myopia complications can lead to blindness. Okay, so let's see how we can explain this in a tactful manner. You can say, I'm not trying to worry you. However, it is important that we treat the condition immediately to avoid any unpleasant outcomes in the future. Regrettably, if left untreated, high myopia complications can lead to blindness. Therefore, as I have mentioned, we need to consider various treatment options. Okay, so that is how I have created a statement here. So this particular statement has been constructed in a way that it is explaining everything in a very tactful manner, because we're giving a very negative news here. We are telling the patient that if it is not taken proper care of, it can even cause blindness. So it is a very upsetting news for the patient. So whenever you give upsetting news like this to the patient, make sure that you are not worrying the patient so much. The patient shouldn't feel like, okay, so I'm going to be blind right now. Okay, so you're telling the patient that there is a possibility of this, but at the same time, if you follow these things, we can actually control it as well. Okay, or there are other treatment options too. So all we need to do is we need to consider the different type of treatment options available. So make sure that whenever you explain points like this, you associate the upsetting news along with some sort of reassurance statements or anything like that, so that the intensity of the negativity or the intensity of the negative news that we are providing to the patient will be a little lesser. Okay, so try to do something like that. So once you have explained the patient that if left untreated, these problems can cause to blindness, so it is important that we consider some treatment options. The patient is going to ask you a question. Okay, so if I take the treatment, will this be cured completely? Okay, you can expect such a question from the patient. So that is what you're going to explain next. I'm sorry to say that this condition cannot be reversed. However, the treatments can slow down the progress of the condition. So that is how we are going to tell the patient that point. Then you're going to continue actually to the next task, because the next task says refer the patient to meet an ophthalmologist for further advice. So you can actually connect your conversation from this point. Okay, I'm sorry to say that this condition cannot be reversed. However, the treatments can slow down the progress of the condition to this one. So I strongly recommend you to consult the ophthalmologist at the earliest for further advice. Shall I book an appointment for you? Okay, so the patient is saying yes, you can book an appointment. So you're responding by saying, I will do the needful. Okay, so it's a continuous conversation that is happening here. So once you have told the patient, I'll do the needful, this is what you're going to say. The doctor will see you in 10 minutes. Is there anything else I can help you with? Kindly wait here. We'll inform you when the doctor is here. Thank you. So that is end of the conversation here. So if you have if you have looked at here, this particular conclusion is very simple, but it is relating to the context that we have been dealing with here. So we told the patient that we will book an appointment for the patient to see the doctor. So before the conclusion also, we told the patient I have booked the appointment, or you are telling the patient that I will do the needful. So consider that you have done it already. So you are telling the patient, well, Miss Williams, the doctor will see you in 10 minutes. Is there anything else I can help you with? So Miss Williams is saying, no, nothing else. So you can say, kindly wait here. We'll inform you when the doctor is here. Thank you. Okay, so that is how you can wind up this entire conversation. So these are the different statements and the task explanations for each task. So I hope it is clear for you guys. You can use the video as a reference too. So you might find that the statements that I have used in the video is a bit different than the ones that I have showed you here. Obviously it will be different because while I was doing the video, I was not, I hadn't prepared any script. That was a spontaneous speaking that you have seen there. So the sentences might be different, but the feedback session is framed for you to learn how easily you can construct statements, or for you to understand how you can move from one task to another. It is for your understanding. So you might find there would be certain differences, or there might be differences in the statements that have been said in the video, as well as the statements that you are seeing in the feedback session too. Okay, but it is for your understanding that these feedback session statements have been created. So I hope it is clear for you guys. So I hope everything was clear for you guys, and if yes, let us know in the comment section, and if you found this really helpful, share it with your friends as well. So I'll see you guys in the next roleplay video. Until then, take care. Bye bye.
IILT, it's my cup of tea.